So as I mentioned in my opening remarks, these are old issues, right? People assigned female at birth have been having children, have been aging since time immemorial, and yet we're only now seeing really accessible and effective solutions. So first of all, I would like to thank you all for the work that you're putting in and for the research that you're doing. It makes me feel a lot better about being a woman at this stage, particularly someone who is going to be postpartum soon, you know, somebody who's going to be entering menopause, knowing that we've got so many fantastic innovators who are creating in this area is really, it's good to know. So I'm going to do a little shameless plug as well here. So I actually launched, along with my co-founder who's in the audience, Rhiannon, the Future of Cycle Care 2022. It's actually the first trend report in cycle care. And one of the things that we identified, one of the main themes we identified was that we anticipate next year there's going to be a much greater integration between clinical professionals and wellness devices and wellness brands. So I'm going to kick off our Q&A session. This is actually directed to Elan, Astrid, and Barbara. You can all answer separately, of course. Do you anticipate opportunities for collaboration between the medical industry and wellness devices? Particularly, I'm thinking with your specific brands in mind. Can you see an opportunity for collaboration between consumer-facing products in the home that are accessible and those that are then available in the medical sphere? So, Elan, I'll put this to you first.
Okay. Well, the answer is yes to all. It's simple. The point here is everybody wants to move medicine towards home, especially when we talk about women who are not sick. Actually, if they're not sick, there's no good reason for them to come to the clinic. So we're striving to bring devices that can be used at home by everybody, definitely even with old ages. When we developed the device, our engineers used to visit old age homes and trying to look at points that were very important for us. Let's say when you insert such a device like our Provade device, there is a certain move of the hand. Now, older women, in most cases, cannot do that form. So we looked at how do we change the device, how do we curve the device so that they will not have to move their forearm too much. Another point here, this is we have to press a plunger. Now we can have a plunger that you should need a machine in order to put in. This is too much. So we went and just developed a device that looks like that, with a spring inside, in order to measure the force, which older women, I'm talking about over 90, in most cases this will not be used by over 90s. Women over 90s can produce. What is the amount of force they can use with one hand? And according to that, we developed a device. So the point is, yes, to try and move the devices or whatever we do to the homes of the women, to the comfort zone.
That's great to hear. Astrid, do you see an opportunity for collaboration? And can you give us some examples potentially of offering consumer-facing products that then collaborate with the medical industry? So I know you talked quite a bit about how you're going to move the patient through a series of really patient-centered design with your app. So can you talk to us a little bit about that and where you see the opportunities lie?
No, I mean, I'm a massive believer in collaboration, especially when it comes to driving real system change. And we're currently collaborating and co-building the product with both public and private healthcare providers to ensure that we enable a better care, like to the end person, not patient, the person. And I think that's crucial because you can't have all different, information and different rehabilitation exercise coming from different sources. It needs to be kind of best practice, and it needs to be in collaboration with like a 360 more holistic view. So we're currently doing a pilot with a private healthcare provider when it comes to utilizing a test group of women and offering them the functionalities of having someone giving them that holistic support in the postpartum, because currently there's no digitalization globally in postpartum when it comes to the actual healthcare provider. It's all physical, it's all, or maybe one or maybe two, depending on what country you are, actually physical appointments. So, and what we can see is also that women are starting to ask for this, and they're starting to understand that this is such a crucial part of their recovery. And it's something that public healthcare, speaking for Sweden at this point, they're so kind of lagging behind in that kind of development. So we need to collaborate to build bridges until they can offer that purely holistic and person-centered solution. So I'm very happy to say that everyone in public healthcare that we've spoken to and in private have been super open to collaborating, because they see the very desperate need of this solution. And I think we need to find ways to collaborate with commercial partners or digital partners to really accelerate the digital transformation that is needed in this segment.
Absolutely. And I think as soon as we make those silos, we take the barriers out of the silos, and we see more collaboration and more conversation between those different devices and data centers, that's going to make a really huge change. And Barbara, I'd love to hear what you think as well about how we can support menopausal women by kind of breaking these barriers down between the medical industry and the services that are delivered in the home and from the commercial sector.
Well, I think collaboration is the key to improving healthcare. And so we have a lot of many different sectors that we need to bring together. We're talking about to help women, whether it's postpartum, whether it's women with incontinence, whether it's women with ovarian cancer. We need to build bridges between all sectors of healthcare with communication and collaboration. And we need to work as one so women are treated holistically, and so that providers in all healthcare sectors understand the maybe not every medical little tidbit, but have a broader knowledge to be able to identify problems and have those resources. And so collaboration creates resources, not just for women, but for providers to offer that. And so especially for menopause, as I mentioned in my talk, is not only physical changes in women, it's psychological changes. And so it crosses many, many roads with regards to physical health, mental health, and overall well-being. And I think it's very important, whether it's nutrition, whether it's drugs, whether it's counseling, whether it's kind of advertising and marketing so that we get the word out there that menopause is not taboo. Collaboration is absolutely needed.
Absolutely. And you mentioned as well how important it is to have rich data, and it's so important to have heterogeneous data points, particularly with women's health. You know, a few people have mentioned just how different it is, how different women experience the same issues. And Kylie, you mentioned as well what you're doing to help women of color to better identify symptoms in ovarian cancer, and I'm sure in other gynecological issues. So can you tell us a little bit about how Aspera is working towards breaking down those outcomes, the outcome disparity for women of color and for white women?
Yeah, absolutely. So first of all, I think I've worked for a lot of different companies, and I have rarely seen a chief executive officer come out and say, we absolutely want to ensure Medicaid coverage, and we are access for all, irrespective of patient or ability to pay. And I love that about this company, is the fundamental belief that nobody, regardless of socioeconomic status or ethnicity, everyone should have access to this care. But the driver of this was, if you looked at the 5-year survival rate for Black women, it's 36% versus 46% in Caucasian women. And then you look at the early diagnostics of this, and I just want to make sure I get all of these statistics totally right. It's absolutely horrific. The OVA1 has 18% higher rate of detection sensitivity for ovarian malignancy versus CA125 in Black women. So when we look at this and we look at, our responsibility to this social justice movement and ensuring that we change the paradigm, not only for the women like my mother and women in my family that, you know, have had this disease and their life cut short. My mother passed away from this disease at 46 years old. But it doesn't have to be this way, right? It doesn't have to be this way for most of these women, and we have a better solution to doing this, but it's going to require this radical horizontal healthcare transformation, whether that's the way that the systems approach women, the way that women approach themselves, the way providers see themselves, and to all of these brilliant panelists' comments across collaboration amongst industry executives to ensure that we all understand how the woman connects together, so we can bring the right tools to the marketplace and really solve for this once and for all.
I'm so sorry to hear about your mum, Kylie. Thank you so much for sharing that with us.
Thank you.
And I do think, you know, a lot of us have talked about empowering the woman and empowering the patient, and seeing her really as a person first. Astrid, actually, you're absolutely right. It's the person, not the patient, right? So I'm really interested to hear as well about how we can use AI in terms of how we bring this industry forward, what the opportunities are. And I know that, Kate, you mentioned some of the opportunities in AI already, and I'd love to hear what you and FemTech Analytics think are going to be the really big opportunities coming up in the next 1 to 5 years time in FemTech with AI.
Great. Well, thank you, Anna. And we mentioned the collaboration, which I think is extremely important. So I'll add my comment to the previous discussion. And actually, the purpose of this event, which is free for all, as well as our open access analytical reports, is to actually continue creating the critical mass and bring the attention to this very important issue of women's health and certain angles how it should be handled. In terms of AI. So we've been big believers in AI for a number of years as it applies to longevity, so to speak, and we have reports on that subject. So FemTech, which is a relatively new space for us, which we would like to explore further with the help of the community, actually appears to underutilize AI, unfortunately. So we see lots of promise in that, and I don't want to elaborate a lot in terms of trends in addition to what we've referenced in the report already. But I think we have excellent speakers here who are in this space, not on the analytics side, but actually working in it. So I would like to hear, their opinion on the key trends, and then I can add my 2 cents as well.
Absolutely. Astrid, as well, you mentioned how you're using AI. I'd love to hear a little bit more about how you're using it, and also where you think the opportunities might lie in the rest of the FemTech.
So no, I'm a big believer in AI, and I think there are massive amount of opportunities because this has been such an under-researched area for such a long time. So I'm very happy to see that people are starting to apply machine learning to these data sets and really find these key findings that can actually create change. So the way that we're doing with collaborating with the research team, because currently when it comes to postpartum, there are a lot of researchers who are focusing on one particular factor, if it's postnatal depression or pelvic disorder. But there's been nothing when it comes to a global collaboration looking at all factors when it comes to a holistic postpartum recovery. So what's important is kind of finding the existing data sets and making sure that we label the data in all the correct ways to be able to actually apply machine learning, train the algorithm, and find these, the key historical findings as well of, just learn from history, because, and it's also frustrating in the sense that some of the data sets exists, but very many doesn't because it hasn't been prioritized, it hasn't been collected. So what we're doing also is when you, as a user, sign up to Leia, we always say that throughout Leia, we will always participate with research partners to really enable innovation and evolution when it comes to postpartum. So we're working on existing data sets, but we're also building our own data sets to be able to really localize and identify those key factors.
That's so interesting, and it really comes back to a stat that Kate shared right at the beginning, which is that so many of these FemTech businesses and FemTech brands are developing just one product. And so we're showing that even though this is an area that's so innovative and there's so much investment that's going into it now as well, people are still just treating disorders one at a time and actually not looking at the healthcare as a whole and the holistic well-being of the woman throughout her whole life. And I do think that's certainly an opportunity that we can see going forward. And I'd like to actually...
Also, oh, sorry, Anna.
No, go ahead.
No, and I think it's so important also to, what I find really exciting with building our own data sets as well, because we're tracking the women's both mental and physical recovery, and that enables us also to have the really, the personalized point of view. So the existing data sets are very much, symptoms versus outcome, but currently we're now being able to tracking, what are the synergies with your mental state combined with your physical state and your relationship with your partner and the social and the economic state and all these different factors that we haven't been able to, to look at before. So it's really just the challenge is just kind of picking the right data to label to have an understanding of what affects, what data affects our data. But that's a challenge I'm very much looking forward to, and I'm happy to collaborate on. So that's why it's so important for collaboration.
Absolutely. And I will just add that according to our analysis, it's only 6% of FemTech companies that, successfully utilize AI in their activities. So, and obviously it's a huge untapped opportunity. And amongst the sectors that do utilize AI, it is the reproductive health, general healthcare, and pregnancy and nursing that lead this trend. But obviously, we need to encompass more and ensure that more than 6% of total FemTech uses AI.
Could I just make a quick comment about that as well, Anna and Kate? Because Astrid, I think you're absolutely brilliant the way you're thinking about this. But when we think about even our algorithm, it's so important. We do the same thing, right? Nutrition, menopausal status. This is all part of the personalized approach to early detection. That's run inside of our algorithm, which isn't part of what the traditional standard of care was. But I think about the way our scientific team is thinking about the future, and it is all about these data lakes. And for us, artificial intelligence and the deep machine learning is critical because of the predictive analytics that we're going to get out of it, right? So I don't know, artificial intelligence has become such a buzzword, I feel like, in the industry. And to me, it's more adaptive intelligence, right? How are we going to get these algorithms, these detection tools, these medical devices, programmatic effects to think about things in an adaptive way and a personalized and precision medicine approach versus just the typical artificial intelligence approach, which I know is also very helpful, but to us and to me and the world, the way that I like to see early detection, the predictive part of this, right? And being able to get very much in front of it is what's the power of those big data sets and data lakes.
I'd like to add that I think using integrative questionnaires and integrative to be able to track your woman's answers and women's modalities, with whether it's physical, whether it's emotional, whether it's relationship modalities, I think are very important and add easy ability to integrate AI and drive outcomes. And so for all of the platforms that we personally are using integrated questionnaires that women fill out as they enter our platform for each visit. And we're able to track over long periods of time the changes, whether positive or negative, that can then turn into these solutions and create data points later on to improve care overall for all women.
And that's going to be the big challenge, isn't it? Is sourcing this data and having proper research and analysis so that we have these data sets to be working from, because we have so much to access at home now, so many opportunities to kind of track our cycles and track our well-being, but without the big data sets in order to map those against, then it really, what are we even tracking for except for our own kind of personal information? So we just have a couple of minutes left. I just want to ask everyone, first of all, thank you so much for your fantastic talks and for such an insightful panel. Are there any closing remarks that you would like to make before we move on to our second section? Kylie, I can see that your mic is off, or you're keen.
Oh, no, I'm sorry. No, I've loved this, and I wish we had more time, especially as a panelist organization, to get together and understand how we can collaborate. I think there's nothing more important than figuring this out, and I know we can't do it alone. We need each other, especially when we're talking about big data sets. It's very important that we build collaboration globally so we can move very quickly. But I'm grateful to you guys for starting this organization and bringing us all to the forefront on it. And I look forward to future collaborations with all of you. Thank you.
Absolutely. And on behalf of FemTech Analytics, I would like to thank everyone, especially Anna, whom I had no idea was pregnant, 8.5 months pregnant. So basically, our objective is to continue this series of, free virtual conferences, as well as to, take either, certain angles of FemTech sectors and, either co-produce analytical reports or collaborate otherwise. But we're delighted that we are starting this, movement. Let me just say that, and we look for, future events, and a number of other, ways we can collaborate. And again, it's our first event and the report. We welcome everyone's feedback, questions, thoughts, and that would be greatly appreciated.
Fantastic. Well, thank you so much, Kate, Elan, Astrid, Kylie, and Barbara. You've all been really fantastic.